Hi, everyone. My name is Jody Brockman, and I'm a nurse here at North Kansas City Hospital, where I get to work with a great group of people as a community health and wellness coordinator. Today, I'm very excited to be a small part of a presentation and grateful to this passionate therapist, Dr. Lyndi Plattner, for not only sharing her time, but her expertise with us today. I believe today's topic is relevant and has definitely touched not only my professional life as a home health case manager, but probably more emotionally while helping my parents navigate their healthcare journey. So, allow me to introduce today's presenter, Lyndi Plattner. Lyndi is a doctor of occupational therapy with years of experience helping adults define health on their own terms. She holds healthcare to a higher standard by providing personalized, proactive solutions that support aging adults in maintaining autonomy and quality of life. With a background in acute inpatient rehabilitation and both independent and assisted living care, Lyndi has seen firsthand the gaps in healthcare services for older adults once they return home. This knowledge has inspired her to found Quality of Life, where she guides clients through complex health management decisions and delivers holistic strategies to meet their unique needs. So guys, the chat is open. You can throw any questions or comments in there. Also the Q&A if that is easier for you. And I'm going to turn it over to Dr. Plattner.
All right. Thank you, Jody. And thank you everyone for joining us today. We've got a lot of good stuff to talk about. So with that, we will go ahead and get started. So from confusion to confidence, mastering your healthcare journey. There we go. So Jody touched on it a little bit, but at Quality of Life, we specialize in private healthcare coordination and advocacy services throughout the healthcare continuum. So you don't have to be in any certain setting. You can be at home, you can be in the hospital, whatever it is, we can provide guidance and advocacy services. Our overall mission is to enhance the quality of life for older adults and individuals with chronic conditions through holistic and client-centered or client-led care. The client is always the center of everything that we do. And like Jody mentioned, I am a doctor of occupational therapy and I founded Quality of Life. So our objectives today. First, we are going to talk about understanding our patient rights. So at the end of this presentation, I hope you feel empowered by knowing your right as a patient or your loved one's rights as a patient in any healthcare setting. We are going to talk about navigating the healthcare system. You're going to come away with practical tips to make navigating the healthcare system easier and a bit more effective for you. We are going to talk a lot about the importance of self-advocacy and understanding why being proactive about your healthcare leads to better outcomes. And again, practical tips for specific healthcare interactions. So this is doctor's appointments to hospital stays. We're gonna get some advice on how you can improve your experience overall. Before we dive into all of those, I wanted to begin by sharing a few data points associated with health literacy and its impact on self-advocacy and health outcomes. So the Suffolk County government defines health literacy as how well someone can find, understand, and use medical information to make decisions regarding their health. I'm going to say that one more time just because there's a lot in that. How well someone can find, understand, and use medical information to make decisions regarding their health. So examples of this include understanding medication instructions, explaining your medical history to your provider, understanding health insurance, different things like that. Health literacy skills are important because they can help us prevent, understand, and manage health issues as they arise. So the specific data, 51% of the population has limited health literacy. Not awesome. Those most at risk for poor health literacy are individuals with an income less than 50,000 per year. And then there's a list of other groups that are most likely to have limited health literacy. 18 to 24 years old, identifies multiracial, separated, have not graduated from high school, out of work for more than a year, annual income less than 10,000, having other living arrangements, or live in a suburban county of a metropolitan area. So with that being said, health literacy is a major issue looking at these stats here. And it's something that we really need to consider because it helps us navigate our health and the healthcare system. So along those lines, higher health literacy is associated with higher instances of self-advocacy, and increased instances of self-advocacy are associated with improved health outcomes. So we're going to focus on this a lot throughout this presentation. So the higher health literacy we have, the more we are able to advocate for ourselves, and the more we're able to advocate for ourselves, the better our health status and our health outcomes are going to be. So I wanted to start here because this is really important to understand. The better we are at advocating for ourselves, the healthier we will be, and the better our healthcare journey is going to go. So great place to start. Moving on to understanding our patient rights. We're building a good foundation here. So we're going to talk about each of these in detail. So we're going to start with the right to informed consent. You have the right to fully understand the benefits, risks, and alternatives of any treatment or procedure before agreeing to it. Your healthcare provider must explain this clearly, and you can choose to accept or refuse the treatment. So you have the right to being fully informed about any healthcare task or procedure or intervention that is being provided. You have the right to fully understand the benefits, and it's your healthcare provider. It's their job to make sure that you fully understand. You also have the right to access your medical records. So you have the right to review, request copies of, and make corrections to your medical records. This allows you to stay informed about your health and be actively involved in your care. This one is a right that I don't know that most people know they have. If you are one like me that's a little type A that likes to get it all in writing to where you can review it later, but you feel, I don't know, is that something I'm allowed to have? The answer is yes. You have the right to view, request copies of, and make corrections to your medical records. So if you do request a copy for your own records and see that something is incorrect, you can actually ask for that to be corrected as well. So this is a key right that I don't know that we utilize very often as patients. So you have a right to kind of know what's going on behind the scenes, if you will. One that I think we are a little bit more familiar with is the right to privacy, or the Health Insurance Portability and Accountability Act, or HIPAA. So your health information is private and protected under this act. Only authorized individuals, such as healthcare providers involved in your care, can access your medical information without your permission. So under HIPAA, you're guaranteed privacy as a patient. If you feel that that right is being violated, this is a great time that you can advocate for yourself. But also know that all of your information is going to be protected until you give permission, say to a loved one that you want in on helping you manage your care or something like that. So they are going to, protect your privacy until you authorize someone else to access it. You have the right to ask questions and get clarification. This is arguably the most important right here. You have the right to ask questions if something is unclear, whether it's about medications, a diagnosis, a procedure. Your healthcare team is responsible for providing clear answers, emphasis on clear answers that you can understand. So if you do not understand, please ask the question and get the clarification. You have the right to do so. You are not a nuisance. And if it takes a few extra seconds, that's okay, because you have the right to ask those questions and get clarification. And lastly, you have the right to refuse treatment. You can decline any recommended treatment or procedure, even if your healthcare provider advises it. Your decision should be respected, and you should be provided with alternatives or consequences of refusal. So if this is not a treatment you're comfortable with, you can refuse it. And you also have the right to understand what alternatives are. And they also should advise you of what the consequences are if you do not choose to move forward with that treatment. I will warn you that there are a few things that if you act against medical advice or AMA, there are times when you might be more responsible for bills, or insurance might get involved. And so I highly recommend that you check into that before you refuse treatment. But again, that is included in the consequences of refusal. And so if you do refuse a treatment, you do have the right to understand all of the implications of that. So when looking at your patient rights, I wanted to briefly touch on the role of healthcare providers. It is your healthcare provider's responsibility to ensure that you are well informed and able to make sound decisions. So that they do have a big role in making sure that your rights are being respected. If you do not feel well informed, it's time to speak up. So yes, they have a role in making sure that things are clear and answering your questions, but they are also not mind readers. And so you do have to speak up for your rights at times in order to make sure that they are being fully enacted, and that you are getting the answers and clarification that you need. All right. We touched on our patient rights. Now that we have a good understanding of what those are, we are going to work through navigating our oh so complex healthcare system. We're going to start here just talking briefly about key players in the healthcare system. I'm sure most of us are familiar with these, but I think we're going to just touch on them real quick because we're going to refer to them later. So primary care, this is your first point of contact for general health concerns, preventative care, and management of chronic conditions. This is sometimes also called family practice or general practitioner. Specialists are doctors with expertise in specific areas. This might be cardiology, orthopedics, pulmonology, endocrinologists. There's a lot of them. Typically, you do require a referral from your primary care physician in order to see a specialist. So again, they're looking at your overall general health, and if you do need to look into something specific, symptoms that you're having or whatever, you do require most of the time a referral first from your primary care. Hospitals and urgent care. And emergency care. I feel like we're pretty familiar with those. And then your care team. This includes doctors, nurses, therapists, case managers, social workers, and pharmacists working together to manage your care. Sometimes we are a little bit siloed. We might be in different systems, or your specialist is in this office and your therapist is an outpatient, but we are a team and we all are working for you and with you to improve your health outcomes. And so if you feel that your team is not working as a team, this is an opportunity you can advocate for yourself and encourage them to talk to each other. It is not an unreasonable request. Quickly, role of insurance. Again, I feel we're pretty familiar with this. Um, Primary insurance pays first. Your secondary insurance helps cover what primary care or your primary insurance doesn't. Um, for those of us familiar with traditional Medicare, a lot of times Medicare would pay 80%. Our secondary would pay the remaining 20%. Disclaimer that is changing in 2025. So please, please, please pay attention to the 2025 Medicare changes. Referrals and authorization. Some specialists or procedures require your insurance to approve them first. So it's always good to check to see if you need pre-approval before your appointment. You don't want to have any unexpected costs or not be able to have your procedure or something like that. And then every single insurance plan is different. So I encourage you to review your benefits regularly to know what services are covered and what your out-of-pocket costs might be to where you can budget. And also if something unexpected came up, you kind of already were familiar with what your benefits are. I know it's not super fun to sit on hold with insurance companies, but I do encourage you to call them if you have questions to where you fully understand your plan. Another pro tip, our healthcare providers work with insurance quite often. And so if you're already with them and you feel comfortable, you can ask them to shed light on anything that might be confusing to you. However, I said this before, healthcare providers are humans that make mistakes. So if you have any doubts or you would like to double check, call your insurance because they know for sure what the answer is. But sometimes when you're talking to healthcare providers, they can at least give you an idea or help just shed a little bit of light on something that might be confusing to you. Okay, now we're getting into the good stuff. So I promise practical tips that you can walk away with and use tomorrow. Tomorrow's Saturday, so maybe Monday. Making appointments. Let's start there. I think it's very important, in my experience, to be clear on the reason for your visit when you are scheduling the visit. So, additionally, it has been a little bit tough to get appointments recently, or maybe not so recently. So please ask for the first available spot, or if cancellations can get you in sooner. Every once in a while, you can get yourself on a list where they call you if they had a cancellation. So spend some time on that making appointment whenever you're on the phone or you're there in the office. Spend a little extra time to make sure that they have a good idea of why you are going in. And if you do have to leave a voicemail, don't be afraid to leave a detailed message. It's actually a great tool because the nurse can listen to it again. They can take good notes if the doctor needs to listen to it. So this is a great way to advocate for yourself, and it doesn't take a ton of extra time or effort to just be clear. Here is what is going on, and I need your help. And they want to know that information. They're gonna ask you anyway whenever you're in there. So giving them a good place to start is always a good idea when you're going into your appointment. Also, this shows that you care about the outcome of this appointment, and consciously or subconsciously, you're going to get good attention from your healthcare team when you show that you care about your health also. They are on your team and they want you to be healthy and successful. Referrals and authorizations. Don't hesitate to ask your primary doctor for referrals to specialists or needed authorizations or double check that needed authorizations are approved before the appointment. This goes for specialists that are physicians. This goes for physical therapy, occupational therapy, speech, a dietitian, a psychiatry, or a counselor. If you feel another discipline may help you, but your doctor hasn't brought it up yet, you can bring it up first. Again, they are on your team and they are amazing and very knowledgeable, but they're not magicians. And so if you have something that you think would be of benefit to you, bring it up. I rarely have doctors say, "Oh, you want someone else on your team to help you with a specific problem that you have, and it's not something that's necessarily I'm not a specialist in. Nah, you shouldn't go see them." Most of the time, they're going to say, "Hey, that actually is a great idea. Thanks for bringing that up. Let me write you the order." So it's okay to bring it up first. Insurance barriers. This is a very important one. If your insurance denies coverage, do not give up. If it is something that you feel should be covered and will significantly improve your health outcomes, it is worth fighting for. You can appeal decisions, and there are people to help you. So, case management support, social work, nurses, they can support you with appealing decisions and help you discuss alternative treatments if it's something that insurance really isn't going to pay for. So if you feel something is off or wrong and you feel this is something that you should have, exercise your patient rights until things feel right, which includes appealing insurance decisions. Lastly, technology and patient portals. Many healthcare systems offer online portals, as we know, where you can access medical records, communicate with providers, and schedule appointments. Take advantage of these. Even if you don't feel savvy with the computer, I'm sure you have a loved one that feels a little bit more comfortable. This is a great place to where, again, you can access your medical records, you can contact nurses. This is even more efficient than leaving a voicemail. It's all in writing and they can send you a message back. It's a great way to advocate for yourself and it not take up your entire day. Also, if you are going to, again, a specialist that's not in the same health system that your portal is, or you saw a cardiologist or psychiatry or whatever, and they have notes, your primary care wants that, your other specialists want that, you have access to that, and you can really increase the efficiency and effectiveness of your healthcare just by accessing your own portal and providing that information if they want it or need it. All right. So I've said the word advocacy quite a bit. We're going to talk a little bit about what is advocacy. This is a primary theme throughout the presentation. If you haven't already noticed, advocacy is so important. We're going to answer this question real quick. Why does patient advocacy matter? I really like this quote from the Suffolk County government. Though some people may feel uncomfortable speaking up for themselves, self-advocacy can help give you some control over your healthcare. Research has shown that self-advocates are more likely to receive better care and get their medical problems answered. I'm going to read that again. Research has shown that self-advocates are more likely to receive better care and get their medical problems answered. This can provide a sense of hopefulness and lead to better overall health. Lastly, it can help your healthcare provider understand you better and give you the confidence to ask for the support you need. So the more you advocate, the better you're going to get at it, the better your health outcomes are. And it can be uncomfortable, but research is showing we have better health outcomes just by advocating. It matters. So I'm really going to hit this point home, guys, because I do think that, again, it is uncomfortable and it can be scary and confusing, and you're like, I don't even know what to say. But the more you practice, the better you'll get at it, and the better your healthcare experience and journey is going to be. So when you actively participate in your healthcare journey, you are going to be more informed in your healthcare decision making. You are going to have greater control over healthcare outcomes. You're going to have improved communication with your healthcare providers, and you'll have improved confidence in your health outcomes. So I'm going to touch on this one a little bit more. Engaging in your care builds your confidence as a patient. The more you advocate for yourself and stay informed, the better you feel about managing your health. This, in turn, leads to better adherence to treatment plans, which our doctors and nurses and healthcare team really likes, fewer complications because you're on top of it and you are addressing things proactively, and improved overall health outcomes. Have I mentioned yet that advocacy improves our health outcomes? Just kidding, but seriously, it's important. So examples of active participation, we touched on this: asking questions, preparing for your doctor's visits, sharing and reminding providers about your medical history and lifestyle, and seeking guidance from allied health professionals. If you're not familiar with that term, that includes social workers, medical assistants, OT, PT, speech, case managers, etc. So tips for effective self-advocacy. I'm going to touch on each of these briefly. Asking questions. Don't be afraid to ask for clarification if something is unclear. It is one of our key patient rights. The more questions you ask, the better you'll understand your diagnosis, treatment options, and next steps. Remember, healthcare providers are there to ensure you fully understand your care. Bring a buddy. Bring a trusted friend or family member to appointments. They can help you take notes, ask questions you might forget, and provide support, making sure you don't miss important information when you're feeling overwhelmed. I think that's something that we overlook sometimes. It's hard to remember everything that you wanted to ask a doctor, especially when they come in their white coat and they've got a limited amount of time and you're trying to remember everything you were going to ask, and you're there for a reason. So you're also probably not feeling well. We're not working at 100% in our brain in those situations. So bringing a friend helps make sure that we don't miss important information. Taking notes also helps us not miss important information because then we have a record to look back on. With so much information coming at you, notes can help you remember what was discussed and ensure you follow through on any recommendations. A pro tip, taking notes can also include asking the doctor to write down important notes for you or the nurse to give you a little summary, or asking the doctor if they're comfortable if you record what they're sharing so then you can look back at it. There are different ways to take notes as well. Call back with new questions. If you think of questions after the visit or you need further clarification after you've left the doctor's office or after the doctor has left you, don't hesitate to call them back in or call their office. It's better to follow up than to guess or make assumptions about your care. They want better carryover because that means that you're going to stay out of their office because you're being healthier. So spending that extra few minutes with you is worth it to make sure that you are following the care plan as they intended it to be followed. Come prepared to your appointment. Prepare a list of concerns. Bring a list of your medications. Make sure that you have a list of your past medical history. Being organized helps you get the most out of your time with your healthcare provider. It also helps you be confident in advocating for yourself because you are prepared for that situation. And then explore other options. This is one that I think gets overlooked a little bit. It's so great when you have a great relationship with your healthcare provider. It really is. But if you're feeling a little bit iffy about the treatment plan, and you want to explore other options, it's okay to do that. It's okay to get a second opinion. It's okay to, because again, I said, we're not magicians as healthcare providers. So if you are like, I think I want to get a second opinion, do it. Exploring other options gives you a better understanding of all of the possible approaches to your care. So we talked about kind of the do's of healthcare navigation. I want to talk about some of the pitfalls. So we're in bold here. We're not assuming the following things. So don't assume your healthcare providers know or remember everything included in your past medical history, medications, or daily life. So it's okay to remind them of those things. And sometimes, we talk about our cardiac past medical history, but we don't mention that to, the dentist. But lots of things are interrelated. So it's okay to remind people of medical history. And, they're not going to memorize your chart. So it's all right to give them reminders. Do not assume there are no available supports and that you are completely on your own. You're not on your own. There are many resources out there. Sometimes we just have to do extra searching to find the resource that meets the need that you have. Don't assume you can rely on memory alone during doctor's visits, especially when you aren't feeling well. We touched on that previously. It doesn't work as well as we think it will. And please don't assume that waiting for something bad to happen in your health is the best course of action. I truly believe it is not the best course of action. Proactive health management can significantly improve your health and wellness and truly your quality of life. All right. Lastly, tips for healthcare interactions. So specifically interactions with our healthcare providers. So when we're talking a visit, this can be for a scheduled doctor's visit, but it can be also a brief visit with a nurse. with a physician or whatever it is during a hospital stay, anytime you're interacting with a healthcare provider. So if you can, prepare a list of questions and concerns, review your medical history with them, the important stuff, and bring a list of medications. Almost always, they want to know what meds you're on. It is very important to consider that whenever we're looking at a treatment plan. While you're talking to the healthcare practitioner, take notes or record the visit with the permission of the physician or whoever you're talking to, and clarify unclear information, one of your key patient rights. After a visit, follow up with questions if they arise, and check your understanding by reviewing the instructions or discharge papers. So if we do give you something to take home with you, maybe read it and make sure it all makes sense. And if it doesn't, we can follow up with questions. I mentioned that you are not alone in your patient advocacy and your healthcare journey, and there are resources available. Here are a few go-tos. So I highly, highly recommend seeking case management or social work assistance, especially if you're in the hospital, if you're on home health, what have you. They have case managers, they have social workers on their team for a reason. It's being covered by your insurance or however you're paying. So I highly recommend utilizing these services. And if you've, shown to be a good patient advocate, that's still okay to rely, or if you feel comfortable with managing your health, I still think it's good to check in with these individuals because they can make sure you're on the right path. They can give you a thumbs up. Hey, you're doing great. I'm here if you have any questions. Or if you're struggling a little bit, they can help you with those things. A lot of hospitals have patient advocates as well, and they kind of help you make sure that you are enacting your patient rights. And so I would ask, hey, do you guys have patient advocates here? I'd love to chat with one. And even that's just an extra person if you're not feeling well to talk through, make sure that you're on the right track as far as managing your health and so on. There are a ton of community support services out there, and it's honestly overwhelming, which is such a great thing. It's so great to know that there are so many community services out there. So I highly, highly recommend looking into what might match one of your needs. And a great thing is that your case manager or your social worker can help you find those community services. Examples are Meals on Wheels, Capable, senior centers. If you don't know about Capable, this is a program through North Kansas City, and they have an occupational therapist and a few other healthcare practitioners a part of this program that can go to your home and make sure that we are safe and healthy and staying in our home. It's a really great program, so I encourage you to check it out. And then another go-to resource for patient advocacy, if again, you are struggling with this or it's feeling uncomfortable or you want some extra support, contacting a private care coordination service, that is what Quality of Life does. So we follow you across the continuum, like I mentioned, and we can be your advocate. Our healthcare background helps provide education to both you and the healthcare providers as far as what you need and that kind of thing. So we are there to help you navigate the healthcare system as well. And I just touched on this, but healthcare coordination, advocacy, navigating insurance, medical records, the online patient portal, managing chronic conditions, we are there for you across the board. So I encourage you, if you are like, I don't know what Quality of Life could do for me, please give us a call. I'm happy to just review. Here's what it would look like if we were to be there for you. Because I said all of our services are client-led and client-centered. And so we focus on only the things that you feel are most important. And I'm happy to have that conversation with you before we get started. So a little bit about Quality of Life. Here are my references throughout my presentation. And I want to thank you all for listening. This has been awesome to put together, and I hope you can walk away with some practical tips. So thank you so much.
Wow, Lyndi, that was great. I know personally, I'm walking away with some tips. You can always learn something
Good.
new, especially advocacy increases health outcomes, right?
It does. It does. I hope I hit that one home.
I think you did. I think you did. I also like that you can ask to have mistakes corrected. Like if you find a mistake in your chart or in a note, that you can ask them to correct that. I think that's pretty cool.
Yeah, I
Um,
think I I wanted to highlight that just because I think we, as a healthcare practitioner, Jody, as a nurse, we aren't perfect, we aren't magicians. We try really hard to be, but we just aren't. So
right.
it's okay to say, hey, this is wrong. And we're happy to fix it because
Mhm.
we want it to be right too. So
We've got a couple of comments. Kurt says, thank you for the presentation. Bree says, great, helpful information. And there are a couple questions, Lyndi, if you have a couple minutes to answer for these folks. Um,
yeah.
One question is, how can you get your office notes from a specialist to your primary care physician? What's the easiest way to do that?
So office notes from a specialist to your primary care physician.
Yeah,
Correct.
and so they can keep their primary care physician updated on their visit with, say, their cardiologist.
Okay. Yeah, that's a great question. So, if you were to have your primary care request that from your cardiologist,
Mhm.
they would then have to go to you and make sure that you are giving permission. So, the better way to do it would be to go to your specialist, in this example, your cardiologist, and say, can you please send this to the primary care? That is automatically giving your authorization to share your personal information, and then you're giving them that contact information. And it's a lot quicker that way because no one's requesting anything. You're asking it to be sent. So I would go to the specialist and say, here's my primary care. Please send this to them. You can ask the nurse to help you with that or the physician. I honestly would ask both, just to make sure that they both heard it.
That makes sense. Great. Looks like someone had a question. The 2025 Medicare changes, they were wondering where is the best place to find what these changes are?
Yeah, that's a great question. So, um, this just happened that they're going to be releasing information because open enrollment started this week, I believe, for Medicare. You have until December. If you are a Medicare recipient, you should have gotten a booklet in the mail that kind of explains here's Medicare 2025. Um, I will say that they just released a bunch of the details to the actual private insurance companies, the ones that provide Advantage plans and so on, just a few weeks ago. And so everyone is still trying to figure out exactly what plans are going to look like. So Medicare.gov is very important because there's a lot of people out there trying to sell your phone number and so on and make you pay for help. So Medicare.gov is where you want to go for changes. You should have gotten a booklet mailed to you. Um, and if you want to call your secondary or your Advantage plan, they will be able to talk about changes as well because it affects them just as much. Um, what I highly, highly recommend is finding a private Medicare advisor. Um, there are a bunch in Kansas City. I highly recommend the Medicare Whisperers. I think that they are a great resource. They actually, it's almost like a real estate agent. They have to go get a certification in Medicare and have like 40 continuing education hours per year just on Medicare. And they
Wow.
can help you decide what is your best plan for you. And almost always that is free to you. They are reimbursed through Medicare or the insurance companies. And so most of these advisors work with like over 100 plans. And so they really can sift through every single plan for what you believe is best for you and match you to that. And they are well versed in the changes for 2025.
Very good. Okay, looks like we've got one more question. This looks like it's about denials and appealing those denials. They're
Sure.
asking the case manager, is that my doctor's office that would appeal for me? And do I have to ask them to do that, or is that something they normally do automatically?
So I would say um, not automatically. They
Okay.
do not automatically appeal things. So I see it most often in acute settings or in the hospital where you were wanted a procedure or your doctor ordered something and then insurance says no, we don't want to pay for that. That is definitely your case manager that can help you with that, and they're probably going to be the one that told you, hey, this was rejected, and they can help you with that appeal while you're in the hospital. As far as at a doctor's visit, there's a little bit more legwork for you specifically. So doctor's offices should have a case manager. And if they don't, they should have access to some sort of social worker, case manager, something like that, that can help you navigate an appeal. But you will have to request it. And they might even need your help contacting your insurance for the actual rejection and things like that. They might need more information from you before they can help you with it. But I would say the words, keep it short and simple, even to the front desk appointment lady. Hey, I would like to appeal something. Who do I ask for help with
Okay.
this? And then ideally, they will have someone that they can pull that is more well versed in those situations. But I'm also happy to help with that if you were, on quality services. That is something that I'd be happy to help with as well.
That's great. Great information. All right. Looks like those are all the questions. You guys want to write down Lyndi's email and contact information, please feel free to do so. And we will email a link out for the YouTube video so you can rewatch it if you would like. And you can also share this with anyone you would like to. You probably know someone who could benefit from this knowledge. So again, we really want to thank you, Lyndi, for your time and your expertise. And then go on out there at northkansascityhospital.org and check out our upcoming presentations. Thanks, guys, and have a great weekend.
Awesome.
Bye-bye.
Thank you.